Hello, everyone. My name is Yuz Yusof. I'm from Leeds. I am reporting for Room Now at EULAR 2022 at Copenhagen, Denmark. Today is the second day of the conference. One of the interesting abstract that come across to my mind is an abstract titled OP0142, which was presented at the abstract session. So this was presented by Professor Moran. The background of this study really is since we now have more options to treat patients with lupus, with 3 drugs now are currently licensed for lupus, which is the belimumab, anifrolumab, and voclosporin. So the questions really, should we use this, or at least trying to control people with lupus disease activity early on so that we don't have much accrual of damage or other comorbidities down the line. Professor Moran and his research team conducted a study on the inception cohorts where they initially derived the target called LLDAS, which is a low disease activity score. So they look into over 4,000 patients. However, there were only about 680 patients who actually were enrolled within 12 months of a diagnosis. So essentially, they were comparing about the characteristic and also whether they managed to reach the LLDAS state early enough. So in terms of clinical characteristic between the people with early cohort, which is newly diagnosed within 12 months, versus established SLE. People in the early cohorts were younger and they had a higher disease activity, which is unsurprising because majority, some certain patients were diagnosed when they come to emergency departments, for example, and this patient also had a higher use of corticosteroid and immunosuppressants. So they then look into comparing the time to reach LLDAS between the 2 groups. Interestingly, people with early diagnosed lupus had a shorter time to reach the LLDAS compared to established patients. So I think this is a good result that these patients be able to reach early on, and what impact this what impact of reaching LLDAS be. So looking at the outcomes, reaching LLDAS were both protective in reducing the SLE flares. This is like for both groups. However, importantly, so we talk about damage just now. So was there any difference? So there was no difference between the 2 groups in terms of accrual damage, but this is probably likely due to low incidence of damage accrual in the early diagnosed people, which was about 14% damage. So I think in terms of damage-wise, I think more longer period follow-up is needed. But also, I think reaching LLDAS is one thing. So like how quickly you reach that, but also importantly, how long do these patients stay in this LLDAS state? I think that will be the next question to ask as well, which I'm sure the investigators will look into this and also trying to answer this. So in summary, I think this is a promising that we can. I think it is a promising approach to set the target from the beginning to reach the LLDAS state in those patients who are early diagnosed. So if you want to get more coverage and contents from the EULAR 22, so do tune in to Room Now, either through the website, Twitter, and YouTube. Thank you.